For my end signature project, I selected the choice of telehealth in nursing. Unfortunately, my project is not 100% finished, as my week was very busy, and I do have some finishing touches to put in, and not a lot of my content is added to this PowerPoint, but it will be completed by Monday. So, telehealth in nursing is a combination of technology and healthcare. It's utilized in many different forms, such as remote monitoring, electronic health records, diagnosis and treatment, video chat, and much more. Telehealth is defined as, quote, the use of medical information that is exchanged from one site to another through electronic communication to improve a patient's health, end quote. Telenursing is the utilization of technology to deliver nursing care and continue nursing practice. Nurses still continue to use the nursing process, yet information technology is integrated into that. With telehealth, the healthcare professional is able to diagnose, consult, monitor, and improve patient outcomes. Some ethical issues that I was thinking about implementing in this signature project are the issues of patient privacy. With telehealth, there is much data to be reviewed by multiple different staff members. Each staff member must have an adequate training on telehealth methods and training on protection of the patient privacy. Multiple staff members accessing the same information could potentially lead to data leaks. It's very important to train staff on HIPAA regulations and healthcare, and also on the system's technology in which they are using. With the integration of technology in healthcare, many have the fear that data stored could potentially be released and shared with those who are not providing care and could potentially be used as fraud. Ensuring proper training of staff, implementation of safety practices, and ensuring of staff following HIPAA policy allows for information stored in electronics methods to be better protected. So, current and future practice. In current practice, telehealth is used to monitor, communicate, diagnose, and treat patients with technology and healthcare professional interaction. Day-to-day use of telehealth by both patient and healthcare provider allowed for ease of access, improved outcomes, and better communication. As technology advances, so will telehealth. New and improved methods are being created to better suit the patient. Technology is constantly improving. Currently, the majority of day-to-day tasks in healthcare are completed with the assistance of electronic devices, systems, and computers. Without the use of technology, transfers of information could be slowed and patient care could potentially be delayed. There are many methods of telehealth allow for the healthcare provider to monitor, diagnose, and treat patients, and also to provide a platform with an ease of access for provider-to-provider communication and also communication between patient and provider. Currently, many remote monitoring options are utilized, and they also allow patients to send over their health status information such as blood pressures, EKG, readings, blood sugars, and general vitals to the healthcare providers in order to better monitor their general health and also monitor medication efficacy. This technology allows the patient to have more interaction with their healthcare, and in the end allows for more personalized and individualized care. As technology advances, more and more options for telehealth will be available to the patient and healthcare providers. So, research on telehealth, though I don't have much on this slide yet, there has been much research in regards to the efficacy of the patient monitoring with remote health. There are many new techniques being developed and that would be utilized both in facilities and could be utilized in home with the patient. Changes in policy. Policy is implemented for licensing, regulation, reimbursements, charging, and protection of patient health. Policy is different per state and is not regulated federally in regards to telehealth. In order to better serve the public, some changes should be made. The current change to implement national regulations to avoid variances per state. creation of opportunities for new models of telehealth to be utilized in care, and also create a uniform policy to ensure better patient outcomes and satisfaction. Changes in telehealth are occurring constantly as technology advances, so does healthcare informatics, and also the methods and systems which are utilized in telehealth and telenursing. As far as those, I'm still completing my research and I have much compiled, I just have yet to add to the PowerPoint.